Good evening. My name's Kayla Miller, and I did my project on borderline personality disorder. So, growing up, I always used to watch TV shows, and they would always talk about borderline personality disorder. And I always kind of wondered what it was, but I never really did too much research because, like I said, I was young. I wasn't going to look that up. But I did my project on this because I wanted to see the different types of personality disorders and what exactly borderline personality disorder was and how it affected people. So, borderline personality disorder can be characterized by impulsive and chronically unstable emotions, relationships, and self-image. People that suffer with borderline personality disorder have very, very extreme and intense moods and emotions. They fluctuate, and it causes a damper on relationships with other people. In fact, people would say that those who suffer from borderline personality disorder are the psychological equivalent to third-degree burn patients. And they say this because people with BPD have no emotional skin, and even just the slightest touch from somebody or somebody just asking, "Hey, are you okay?" it's going to cause them to have an intense breakdown, and it's very abnormal for them as it is for us. Like, we don't have an intense scale of emotions like they do. So, with that being said, some of the symptoms of BPD, or borderline personality disorder, are intense fear of abandonment. And this is one of the main symptoms that I saw when I was doing my research, because borderline personality disorder usually starts from a young age. And when a young child is abandoned, they're going to carry that with them their whole entire life. Another symptom would be a pattern of unstable relationships. Because of their intense mood swings and their intense feeling of emotion, a lot of people aren't going to stick around. A lot of people don't know how to cope with somebody that has borderline personality disorder, and I think that's really sad. Another symptom would be rapid changes in self-identity and self-image. With this comes a lot of things. One of those things would be suicidal thoughts and feelings, as well as a continuous feeling of emptiness. Now, the continuous feeling of emptiness also goes along with the suicidal thoughts, as well as the mood swings. There is treatment for borderline personality disorder, and they range anywhere from talk therapy to stuff that kind of rewires their brain in a way. It doesn't really rewire them because you can't exactly cure borderline personality disorder. You can only make it better, if that makes sense. So one of the treatments is dialectical behavior therapy, and in this therapy, they focus on their current emotion, whether it be sadness, happiness, anger, or worry. And it teaches them how to control those intense emotions because, like I said in the beginning, people that suffer with borderline personality disorder, their feelings are more intense than a normal person's emotions would be. It also reduces self-destructive behavior because they're very self-destructive. And it also improves relationships because it's working on the things that are hard to cope with. Another version of therapy that they use is mentalization therapy, and that's a form of talk therapy. Talk therapy is the number one therapy that they want to use. If they have to use anything else, they don't really want to. They just want to use talk therapy because it seems to be the most effective. So, mentalization talk therapy helps someone with borderline personality disorder understand others and how they feel. Where on the contrary, transference focused therapy is a therapist-patient basis, so it feels like it's one-on-one. You don't feel like you have other people in your business, and it kind of makes it easier for them to talk about their disorder. And they help people with BPD understand their emotions and interpersonal issues because, like I said, when they're younger, that's when a lot of this stuff surfaces, and that's why they suffer from these extreme mood swings. Another treatment is medicine. Medicine is not going to cure borderline personality disorder. However, it's going to help suppress the feelings that come from depression and anxiety, which come along with borderline personality disorder. And lastly, there is self-care. So, for self-care, what a person with BPD can do is exercise. Make sure that they walk every night or run, whatever makes them feel happy. They need good sleep habits. Getting good sleep is going to help tremendously, and a nutritional diet. Now, how would I cope if I had borderline personality disorder? I would try to calm myself down in one of my intense episodes, like my mental breakdowns. I would also try to focus when I am having a mental breakdown and really try to maintain my breathing so that I don't hurt myself. And if anyone's around, I'm going to ask for help, or at least try to. And I know for people that suffer with borderline personality disorder, it's hard for them to talk about it, and it's hard for them to ask for help because they don't want to feel too needy or like they're asking for too much. And how would you cope if a loved one was diagnosed with borderline personality disorder? So it's not really about how I myself would cope if someone that was close to me was diagnosed with it. But, I mean, I guess it kind of is. But I would try to be gentle with them and be soft with my body language and how I speak to them. I don't want to come across as angry. I don't want to come across as mean and not sympathetic. I would make sure that I'm being engaged and listening. I want to hear what they have to say, and I'm going to make sure that I validate what they are saying. When a person does not feel validated, they are going to do anything in their power to hurt themselves. They just will. Because they want to be heard. They want to feel like they're loved, and they want to feel like somebody is actually there for them. And lastly, with that being said, I would be compassionate and love them. Just because they're suffering from a disorder does not mean anything. They still need love just like you and I need love. And yeah. So, I did my presentation on borderline personality disorder, and here's my sources.